Yeah, my name is Holm. I'm a consultant psychiatrist and editor of the journal Global Psychiatry Archives. And I wanted to give you some information about stigma, work satisfaction, burnout, fatigue among healthcare workers in Nepal. It's a paper by Singh, and they're from the Nepal universities from Kathmandu, Lalitpur, Tribhuvan, and the TLMN hospital in Lalitpur. Anyway, so the importance is about what type of stigma people experience and do they have stigma. The methods was 421 healthcare workers, assistants, nurses, doctors, paramedics, and 50% of them are female. And they included some characteristics, but the important part is the discrimination towards COVID patients, accepted or COVID patients, and the quality of life in terms of work satisfaction, burnout, and fatigue. Okay, so they have different scales, and they look carefully at a sample of patients, and the instruments were more or less collected in in Google Forms, and there were scales adopted from Social Stigma, and you can read this up in the paper. I want to come to the results, which indicate the gender distribution, so 50 males more or less. Then a type of job, doctors, nurse, healthcare assistant, paramedics. Interestingly, from different areas of the Nepal country, and different types of primary, secondary, and tertiary services. An important part is how many people had experience with providing services to patients with COVID. Okay, so the question is now, that's table 2, the association of background variables versus subscales of stigma. So the outcome here in this analysis is the social stigma, and the quality of life. And the question is, what are the criteria which are related to these or dependent on these variables? Sex or gender, type of job, province, healthcare facility, and whether they serve patients. So what you can see is that, give an example, female doctors, have there seems to be a higher level of discrimination, but it's interpreted differently. But apart from discrimination, there's nothing different very much about male and females. Doctors and other healthcare workers differ slightly in discrimination, and you have to read the details in the paper. And what seems more important is whether they served COVID patients. So people who served COVID patients usually had they have a higher acceptance of patients. Even though this difference is not very significant, and so, but other variables, the quality of life and professional life, burnout, that was different again in people who have served and who have served patients. And the next one is more or less this multivariate analysis, which is possibly more relevant than the other. And the question is, this is now a low satisfaction with a job, and that's more or less related to none of these, to none of the age, gender, or the served patients, whether there's discrimination or not. Quality of life depends more or less if people have more fear. So low satisfaction means higher satisfaction, and people who have had contact or not, who have no contact are having more or less. I'm a bit confused here now. people with no fear have a higher job satisfaction. And this is more or less one of the few differences. And then now coming to the social stigma. So social stigma as an outcome variable. And it seems to be, again, that the acceptance of COVID patients and fear of patients is more or less the variable which influences low burnout. So if you have low burnout, that means that there's a higher likelihood, this is a reference, that there is no fear, or no fear leads to less burnout. That's it. Okay, coming to the other final variable is low fatigue. Low fatigue, again, seems to be related to fear as well as to acceptance of patients. So that's more or less. So there are different variables which influence the fear and anxiety, but let's be honest, it's a sample size problem that, and the patients are not representative and randomly chosen. Hence, this study needs to be repeated. However, it gives some ideas which variables are relevant for, stigma, discrimination, and poor quality life in doctors and nurses and other healthcare workers. If you want to read the paper, please do so on this website, www.globalpsychiatry.co.uk. And if you feel like that you like some of these explanations, then please check or subscribe to our website or YouTube channel, Global Psychiatry Archives. And if you liked it, please let us know. Thank you. Goodbye.